Hello everyone, I am Dr. Kiran Vyavhare, consultant anesthesiologist and pain physician at Wokhad Hospital, Nagpur. Welcome to my channel on anesthesia, awareness and surgery. As I had promised in my previous video, I am coming today with a new topic, that is pre-anaesthetic checkup, which we call PAC. So what is this PAC? PAC means you meet your anesthesiologist. It is like the first meeting with your anesthesiologist, where the anesthesiologist decides whether you are fit for anesthesia or not. He will be asking you a few questions and then he would be giving you some investigations. So let us discuss about pre-anaesthetic checkup. The first and the foremost thing that the anesthesiologist is going to ask you whether you have any cough, cold or URI, that is upper respiratory infection. This is important for us because normally the patients usually have cough and cold when there is a change of temperature, when it is cold and when it is hot. So people think this is a very normal thing, it's only cough and cold. But in anesthesia it is not so. Why is it not so? Because this airway is reactive. That means under anesthesia it can cause problem. So you should tell your anesthesiologist if you have cough and cold. What will he do? If it is an elective procedure, that means it is an elective surgery, then he will give you an antibiotic cover and he will try to subside that infection. So first and foremost you should tell him this. Then if you have some hypertension, blood pressure issues or diabetes, this is also very important. Why is it important? If your BP is too high, then there are chances that there might be more excessive bleeding. So you should tell the anesthesiologist about your medications that you are taking, any antihypertensives that you might be taking. Another thing is diabetes. Now why diabetes is important? Because if your sugar is high, then what will happen? Your healing, the surgical wound healing would be delayed. It will take time. So you need to have your sugar under control. That is another thing. Then one more thing is, if you have any thyroid issues, if you are hypothyroid or hypothyroid, again you should tell your anesthesiologist. Another important thing is if you are suffering from epilepsy. So in short, you should realize that any problem, any medical disorder that you have to inform your anesthesiologist. Don't think that this is a minor issue and I need not tell the anesthetist, but you need to tell him everything. He's like a friend. He's going to cure you, he's going to help you out, and according to your condition, he will be deciding the type of anesthesia. Many other important things are, if you have any cardiac problem, if you have any valvular disease, or if you have any angiographies done, angioplasties done, or heart surgeries done previously, that is also very important, because any anesthesia that we are giving, it goes directly to the heart and it is going to cause your heart to less function. So it is important that you should tell your anesthetist that you are suffering from some problem. So these are many factors, many things, any allergies, any previous surgeries, any problems that might have occurred initially have to be told to the anesthesiologist. So every time you go and meet your anesthetist, please tell your detailed history. After asking you detailed history, he will give you certain investigations like your complete blood count, your hemoglobin, your routine investigations like the creatinine. So every organ, that is the kidney, the liver, that will be tested. According to that, he will decide what type of anesthesia he will be giving you. So always remember, do not hide anything from your anesthetist, because he is your friend, he is going to give you anesthesia, and remember always that whatever problem you have, you should not hide. One more important thing is, before any surgery, you should not take anything orally. What does that mean? You should not eat anything at least 8 to 10 hours prior to surgery. But sometimes in case of emergency, we do accept if you have taken something 6 hours prior, because that is an emergency and we need to take you for surgery. So according to the importance, then we decide whether to go ahead with anesthesia or not. Now why is it important? Because after giving anesthesia, whatever food you have taken, that comes into your windpipe, and that is known as regurgitation, and that is aspirated. It goes to the lung. What will it cause? If the food enters the lung. Now the lung is a organ where oxygen and carbon dioxide gases are exchanged. If food goes into your windpipe and your lungs will be damaged, and that is a very big problem for us anesthetists as well as for you as patients, because if you have a damaged lung, then it will lead you to a ventilator. So please be careful. Don't hide if you have had something. By chance you have taken something, either you have taken milk, solid food, juice, anything. Do not hide it from your anesthetist. Just tell him. And what will happen? That surgery will be delayed for a few hours. But that is okay. That is okay because your life is more precious. So please don't hide anything from your anesthesiologist. He is your best friend. And pre-anesthetic checkup is the interview, like knowing each other. The anesthetist knows you and you know the anesthetist. So that is how it should be. I hope you liked this video, and if you have any queries, please feel free to ask me. Thank you.